Hi everyone, I'm Sandy. Today I'm going to be talking about kidney acute renal failure. So acute renal failure, also known as acute kidney injury, is a condition characterized by a sudden and rapid decline in kidney function. The causes of acute renal failure can be multifactorial, involving a combination of genetic, environmental, and behavioral risk. So genetic factors, while there may be genetic predispositions to kidney diseases, the majority of cases of acute renal failure are not directly linked to genetic factors. However, individuals with a family history of kidney disorders may have a higher risk. The environmental factors, several environmental factors can contribute to acute kidney failure. Exposure to nephrotoxic substances such as certain medications, NSAIDs, antibiotics, contrast agents, heavy metals, and toxins can damage the kidney. Additionally, infections, particularly severe and untreated ones, can lead to kidney damage. And the AI models. So the first one is a predictive analytics. So machine learning algorithms analyze large data sets, identify patterns and risk factors associated with acute renal failure, assist in early identification of at-risk individuals. The second one, data integration, combine genetic, clinical, and lifestyle data for comprehensive risk assessment. Proactive intervention, AI models support healthcare professionals in early detection and management, detrimental to traditional methods. So the demographic, it affects individuals of all ages, but it's more prevalent. It's more prevalent in older adults. In United States, the incidence is estimated at around 200,000 cases per year. The elderly, those with pre-existing conditions like diabetes or hypertension, and the individuals with history of kidney diseases are at higher risk. Globally, incidence varies, with developing countries facing higher burdens due to infectious diseases. So targeted prevention strategies and early management are crucial for mitigating its impact. And so let's talk about anatomy. Look at the picture. The kidneys are two bean-shaped organs that fill our blood. Our kidneys are part of our urinary system, adrenal gland, kidney, uterine, bladder. Kidneys filter about 200 quarts of fluid every day. And let's get the details about the kidney. The outermost part is a capsule, 3 layers of tissue or fat, cells, and stabilize kidneys. And the renal artery regulates blood into kidneys, pumps over 5 cups of blood per minute. And the purple part is the kidney cortex. The outer nephron starting part produces erythropoietin for red blood cells. And the gaps, those called the medullary inner area with nephrons for urine directs to the renal pelvis. And the renal papillary pyramid-like transfer urine, vulnerable to dehydration and certain medications. And the gray part, the pelvis, the funnel shape, collects and sends urine. And the next part, the renal vein, carries filtered blood back to the heart. And each kidney has one renal vein. And the organ system, organs and tissues are most affected by this disease are kidneys, of course, uterus, bladder, urethra, the vascular the vascular system, renal arteries and veins supply and drain blood to and for the kidneys, crucial for filtration, systemic circulation, blood vessel transporting oxygenated blood to organs and tissues. So, and let's talk about nephrons. It's a big guy here. The acute kidney injury describes a range of conditions in which nephrons are damaged, impairing their functions and reducing the efficiency of filtration through the glomerulus. So each of our kidneys is made up about a million filtering units of nephrons. Each nephron includes a filter called a glomerulus here and tubular. The nephrons work a two-steps process. The glomerulus filter the blood, and the tubular returns needed substance to the blood and remove wastes. So, when our kidney got affected and the acute renal failure happened, we're gonna get, impaired the filtration, and the filtration rate is decreased, and we have retention of toxins, and our fluid electrolyte imbalance happen, and which impacts blood pressure and cell function, and systemic impact the cardiovascular system, the nervous system. We are gonna get confused and cognitive affections and hematologic system, anemia due to reduced erythropoietin production. So some patients in myelite, their hemoglobin is really low because they just can't produce the blood. That's why they need the injection called apotin every day or like every another day, because basically there's no or like very low oxygen in their blood, which is really, really dangerous. So it's life-threatening. So that's why they need the injection to make them alive, basically. So the physiology. So normally, kidneys filter blood, regulate the electrolyte, and remove waste. When it's disturbed, the filtration got reduced, and the electrolyte imbalance happen, and the waste buildup. Symptoms like decreased urination, fluid retention, fatigue, and weakness, nausea, and confusion, because electrolyte imbalances affecting the nervous system. So, and let's talk about more the electrolyte reabsorption. The kidneys regulate water electrolytes lead through a process called reabsorption. Reabsorption works by pulling the electrolyte from the nephron tubulars back into our blood. Along with water and other small-sized particles, if we have too much of certain mineral, the kidneys get rid of extra by releasing into the tubulars by expel some waste called excretion. If the kidneys aren't working well, electrolyte can build up in the blood. So when electrolyte disturbances happen, like a severe imbalances in the potassium or sodium can disrupt kidney function, leading to acute kidney injury by affecting blood flow, cellular function, and overall renal homeostasis. And so the filtration, let's talk about it. The blood flows in the tiny filter called the glomerulus. The pressure in the glomerulus push out the fluid in the cup-like structure here, the Bowman capsule. And the collection, Bowman capsule collects the filtrate, the fluid, and the moves to the renal tubular, essential stuff like water, salt, like sodium, salts, potassium, and other important substances are resolved in the filtrate back to the blood, and the urine formation. What's left in the tubulars, including waste products, like here, waste products, they become urine. It's spilled out from the tubulars. And now, so the long-term consequences, untreated acute renal failure may lead to chronic kidney diseases, cardiovascular complications, and irreversible kidney damage. Mortality rates vary based on the cause and the severity of acute renal failure. Some cases have better prognosis. Severe cases may have a higher mortality rate. And the diagnosis involves assessing medical history, physical examination, and laboratory tests, serum creatinine, BUN, which are two most important numbers we've got to check when patient has acute kidney failure or every kidney diseases. Image studies like ultrasound may identify structural issues affecting the kidneys. These diagnostic steps provide a comprehensive understanding of the patient's kidney health, aiding in accurate and identification and classification of acute kidney injury. And the treatments include the fluid management, addressing underlying causes, medication, and dialysis if needed. The AI is in elderly detection and treatment planning. And side effects, like here we mentioned, and the side effects include fluid imbalance, electrolyte issues, and infection risk. The prognosis varies, and AKI can be one-time event or recurrent, depending on underlying factors. And okay, and that's it. And these are references. If you guys are interested in this, you guys can go check those links. And thank you so much.